What I want to do today is talk about a national prospective study that's being conducted by the Bone Marrow Transplantation Clinical Trial Network, or BMT-CTN. This is BMT-CTN 1301, also known as Progress 2, which is a study looking at 3 different approaches to prevent graft versus host disease in patients with acute leukemia and myelodysplastic syndrome undergoing an allogeneic stem cell transplant from a match-related donor or a match-dam-related donor. And the 3 approaches are a standard arm with tacrolimus and methotrexate, an experimental arm that is based on strategies developed at Sloan Kettering using CD34 selection with the Miltenyi device, and the 3rd arm is an approach developed at Johns Hopkins where patients get post-transplant cyclophosphamide. This is a large study that includes up to 345 patients, and to date we've accrued over 100 patients in more than 20 centers in the US. So data being presented at ASH this year by our group is really focused on some of the relevant data to the CD34 selection approach. And so we recently published a paper in BBMT where we show that the comorbidity index developed by SORA, HCTCI, is actually predictive of outcomes in these patients with acute leukemia undergoing a T-cell depleted transplant. And what was interesting is when you look at the HCTCI, normally you have 3 different groups: low risk, intermediate risk, and high risk groups. And what we found with CD34 selection is that the results of the low risk group and intermediate group actually track together, and that they have better outcomes, suggesting that with CD34 selection and the absence of calcineurin inhibitors or methotrexate, you may actually decrease the toxicity of the transplant, and that allows you to do more intense transplants in older patients.